Thyroid lymphoma is uncommon, usually localized. About 1 to 2% of the diagnosed lymphoma is the thyroid lymphoma. The role of surgery is only for diagnosis, secure airway, and almost these lymphoma are always B cell lymphoma are there in the thyroid. And these are usually in the stage 1E, that is localized to the thyroid, and stage 2E, there is cervical or superior mediastinal node are involved. E designation indicate that there is an extranodal organ involvement is there. The principal role for the surgery is to establish the diagnosis of the lymphoma and ensure a stable airway, since thyroid lymphoma often present with bulky mass with significant compression of the airway. Tracheostomy is sometimes necessary in cases where airway is highly compromised, and open biopsy is sometimes needed when there is FNAC and open the true cut biopsy is negative. Then we can go for open biopsy in the lymphoma. If the FNAC biopsy is diagnostic, then surgical role is limited, and most patients treated with the chemotherapy, radiation therapy, or combination of two. Most of the time there is large B cell lymphoma is there in the thyroid. If there is malt lymphoma, malt means mucosa associated lymphoid tissue is there, then surgery is the curative if it is limited to the thyroid. If this malt lymphoma is extend beyond the thyroid, then you have to add the chemoradiotherapy for the patient in the malt lymphoma. But most of the time these lymphoma are the large B cell lymphoma which can be treated with the chemoradiotherapy. For stage 1 and 2 presentation of the thyroid lymphoma, the curative treatment approach involve radiation alone or sometimes combined modality with the chemotherapy followed by consolidation radiotherapy. If stage 3 and 4 is there, then this should be treated with the chemotherapy. And this is post radio chemotherapy CT scan showing complete resolution by the CMT therapy, combined modality of the therapy, which include CHOP-R regimen, cyclophosphamide, doxorubicin, vincristine, prednisolone, rituximab, and moderate dose of radiation therapy between 30 to 40 gray up to 3 to 6 weeks. And you can see this is almost complete resolution of the disease. And T cell lymphoma are very rare, but treatment is same like the B cell lymphoma. So in thyroid, diffuse large B cell lymphoma is most common.